For this part of the series, I wanted to dive into some more advanced discussion of billing codes and the different types so that you have a more advanced understanding of billing codes and what they are and how they're separated and where they come from. So I think it's important to understand where they originated in order to get a better understanding of what they are. So in the intro to billing discussion, I did define CPT codes. So just as a reminder, these are the codes that you're most familiar with in billing, and they are the codes that are maintained and copyrighted by the American Medical Association. These are those 5-digit numeric codes that you're very much used to seeing for E&M visits, office visits, episodic encounters, etc. And they are, as I said, that 5-digit numeric code, which can also have a 2-digit modifier on them. And I do go into modifiers in several of the discussions, so if you want a better understanding of what I mean by a modifier, please jump into some of those other slides. Now, CPT codes that you're familiar with, they're also what we call HCPCS or HCPCS Level 1 codes. HCPCS standing for Healthcare Common Procedure Coding System. And to understand kind of the history behind HCPCS or HCPCS coding and CPT code, I think it's good to just have a basic understanding of that history. So prior to streamlining billing codes for all patient encounters, all visits, all procedures, the American Medical Association was the first to do this. And they did this in the 60s, developing their CPT coding system. At the same time, there were government entities developing their own healthcare service billing codes. And it wasn't until the 80s that CMS, or Center for Medicare and Medicaid Services, merged their terminology, their coding system, with the American Medical Association's CPT codes. So that is why when I'm saying HCPCS Level 1 codes and CPT codes, they are the same thing because they were merged in the 80s to align with some of these common services. Now, they realized in doing so that there was a large portion of unstandardized products and services being provided, and thus became the development of the HCPCS Level 2 codes. And the Level 2 codes, these are going to be more so products that are provided rather than services such as an office visit. And when you have patients who come in for, let's say, a CPT coded visit, like a 99213, for example, you are also sometimes using a HCPCS Level 2 code. For example, say they are given a vaccination at that visit, and that's going to be a product that is provided. Those are the HCPCS Level 2 codes. So when you see a 5-digit alphanumeric code, so starting with an alphabetical character, such as down below I have that G code for wound closure, knowing that that's actually a HCPCS Level 2 code, you'll kind of understand, okay, this is a bill for the product provided. And just to illustrate the wide variety of HCPCS Level 2 codes that are out there, there are thousands of them. And this is everything from, say, alcohol and drug abuse treatment, durable medical equipment, ambulance services, injectable medications, chemotherapy, vision and hearing services, radiologic or diagnostic radiologic services, screening procedures. The list goes on and on. But I wanted to make a quick differentiation because there is one time where it's pretty evident, depending on where you work, that you're going to be using one versus the other. And that's when we're talking about diagnostics used either for screening purposes or diagnostic purposes. A great example of this being things like mammography, colonoscopy, um, DEXA scans. Whenever you are ordering these diagnostics for screening purposes, these are going to be HCPCS level 2 codes. Um, when it's for a diagnostic purpose, say the patient presents with um, a breast nodule, or that they would not otherwise qualify for a screening mammography, and you send them for diagnostic mammography, these are going to be coded under the CPT codes, and that's because you are you are billing for the service of that screening diagnostic. Whereas with a level 2, a HCPCS level 2, you are billing for the service of um, screening mammography, preventative mammography. So I just thought that this was important to understand. There are the different levels of CPT codes versus the HCPCS level 2 codes, and when they're appropriate and when they're not. And you'll easily identify them now, just knowing that those HCPCS level 2 are always going to start with that alphanumeric um, coding, whereas our CPT codes, which are our HCPCS level 1, are always going to be numeric codes. So in several other discussions I have here, I talk about those two-digit modifiers. So those are really applicable, especially if you're in any area of practice where you're performing a procedure. Procedure being really anything from EKGs to a wound IND, etc. So jump into some of those other topics where I discuss procedures and modifying visits to carve out separate procedures within the visit.